Hello. I did my presentation on Clostridium Difficile, also known as C. diff. First, I'm going to talk about the pathogenic name and classification. Clostridium Difficile, also known as C. diff, is a gram-positive spore-forming anaerobic bacillus. There are two prerequisites developing C. diff, which is associated also with diarrhea. The first one is the disruption of the normal gastrointestinal flora, which causes diminished colonization resistance, sort of like mimicking C. diff. And then there's also the acquisition of the organism from a exogenous source. So C. diff is cultured and isolated. A C. diff stool culture is a specific kind of culture. It's different than the typical requested bacterial stool culture. This has to be grown in an anaerobic environment, making it more labor intensive with a relatively slower turnaround time. So for the lab testing, they require you submit fresh stool for the samples for the C. diff. They want you to avoid repeating testing. They want the sample to be refrigerated, and the specimen has to be collected in a clean, watertight container. So C. diff is shed in feces. So any surface that becomes contaminated with feces, it should serve as a reservoir for C. diff. C. diff spores can also be transferred to patients through the hands of healthcare workers who have touched the patient or surface or anyone contaminated with C. diff. So for the mechanism of the disease, C. diff bacteria enters the body through the mouth. It can begin reproducing in the small intestine, and when it reaches the colon, it can release tissue damaging toxins. So these toxins are going to destroy those cells, and it's going to produce patches of inflammatory cells and cause watery diarrhea. When the bacteria is outside of the colon, virtually anywhere in the environment, it's in a dormant state. This enables the bacteria to survive for a long time in any number of places. So some of the signs and symptoms of C. diff, they usually develop within 5 to 10 days that the person may have been in contact, or also after starting antibiotics. However, they may occur as soon as the first day or up to 3 months later. So some of the mild to moderate infection signs include watery diarrhea, of course, 3 or more times a day. And then you're also going to have mild abdominal cramping. And some of the severe signs include, of course, watery diarrhea, but it's 10 to 15 times a day, rapid heartbeat, dehydration, nausea, kidney failure, blood or pus in the stool. C. diff infection that is very severe may also cause intestinal inflammation, leading to the enlargement of the colon, or it could cause you to be septic. Diagnosis of C. diff. So there are a couple ways that they detect C. diff. One is by the stool test. If someone says they think they may have C. diff, the doctor may order some laboratory tests. There is a colon examination that can be done. There's also imaging testing. If the doctor is concerned about possible complications, he may order a abdominal x-ray or CT scan to see. And on this imaging test, it's going to show if there's thickening of the colon wall, if there's enlargement of the bowel, or if there's a perforation, which is a hole in the lining of your colon. So some of the treatments for C. diff are antibiotics, of course, vancomycin, fidomycin, I'm sure I'm not saying that right, metronidazole, which may also be used with vancomycin. They may also do surgery for the C. diff, which when they do the surgery, it's going to remove the disease portion of the colon, which in some cases, of course, the surgery could cause organ failure. It could cause severe pain, and it could cause inflammation in the abdominal wall. And treatment for people who currently or reoccurring have C. diff, they recommend having antibiotic therapy done, antibody-based therapy, fecal microbiota transplant, or taking probiotics. So some of the preventions, which are kind of common, avoid any unnecessary use of antibiotics. Antibiotics are sometimes prescribed for conditions that aren't helped by these drugs. So they recommend you take a wait and see approach for the illness. Hand washing is vitally important, because if you know somebody who has C. diff or you suspect you touched the surface, hand washing is very key to keep the germs away. Sanitizer is also an effective way of preventing C. diff. Contact precautions. So people who are hospitalized with C. diff, they do have to have a private room. They're not allowed to be around anyone. It's called a buffer zone. You have to keep a buffer zone. So the hospital staff and the visitors, they have to wear gloves and gowns while they're in the room with those patients. And also just thorough cleaning. So in any healthcare setting, all surfaces should be disinfected with the product that contains bleach, because C. diff spores can survive exposure to just regular routine cleaning products. So if it doesn't contain bleach, it's not going to kill C. diff. And that is the end of my presentation. Thank you.